So we further evaluated our experience with ADOC and compared it to a period when we didn't have any artificial intelligence in our system. We presented this just recently at the Vascular Annual Meeting in Chicago, and our work with artificial intelligence improves initial evaluation and follow-up of the patients with a AAA. This is a reference to it. Next slide, please. So here's a summary of our study methods. All patients were divided into two periods, one before AAA AI implementation and one after. All patients that actually had a known abdominal aortic aneurysm, known repairs, or studies were specifically performed for screening were excluded from analysis. And study compared patient and imaging characteristic, initial evaluation and long-term follow-up. And also we evaluated the metrics for aneurysm care, like appointment for identified aneurysm and time from consultation to actually repair if the repair was indicated. And we designed the study to evaluate the primary outcome in the study is clinical evaluation within 6 months of incidental identification of AAA on any imaging modality, confirmed with radiology report. Next slide, please. So these are the results. In summarizing this table, pre-AI, post-AI, you can see that there were roughly 316 patients that we evaluated. We identified pre-AI and 220 after AI implementation. So imaging were obtained, clinical appointment was obtained after imaging before AI implementation within 6 months, only in 18% of patients. And we actually improved that to 42% after AI implementation, and that was statistically significant. And you can see from the scan to appointment, the days actually decreased significantly. Our goal was to get these patients to the clinic within 2 weeks, but the average was 22 days. Long-term follow-up also was statistically significant. 65% after initial consultation had a long-term follow-up. In pre-AI settings, we increased it to 99% with the use of that management tool. Number of ruptures decreased, but there was only one rupture in post-AI settings. The numbers are very small, and we still have to see if it truly decreases the rupture rate, but I will hope that AI will help us better manage this patient and reduce ruptures. And AAA repairs were offered roughly the same number of patients in pre and post-AI settings. But what is significant is the time to repair actually decreased dramatically. 58 days from the moment we consulted the patient. From the time we identified on the imaging, we consulted the patient and scheduled them for repairs. In post-AI settings, it was 58 days. Next slide, please. So in conclusion, AI-assisted AAA management really increased the proportion of patients that actually received initial evaluation and were scheduled for subsequent follow-up visit. and were reminded that the patients need to come back for additional imaging and follow-up. And we gained clinical efficiency, really. We decreased the time to initial consultation, we decreased the time to initial repair, and we hope that the implementation of all those algorithms and all the system will actually result in a decrease in the rupture rate.